Now coming to the clinical features, injury of the meniscus could be acute or even chronic as well. In acute cases, there is usually always a history of trauma, and sometimes it's more common towards the young population, so there is always a chance injury during sports activity, especially those people who are amateur footballers or amateur players. For example, people who just play over the weekends, they usually have a more chances of getting this type of injury because their body is actually not due to that kind of an athletic activity, and when during over the weekends they try to exert their body over an activity, this usually results in that type of an injury. In our case, he was a furniture maker. He was working as a furniture maker, but over the weekend he used to go and play football, and that is where this is a classical usually presentation of amateur players getting meniscus injuries, especially in the case of acute injuries. Usually the injuries sometimes could be very trivial. They may have slight popping or mild pain and they may continue playing, and sometimes the injury could be severe enough that they may have to stop playing because of swelling and pain as well. And sometimes this meniscus injury is associated with the ACL injury, which is another problematic in which the patient is unable to even continue play or even bear weight on the knee. So that is important because history is more important. What type of injury it was? Was it a rotary injury? Was it sometimes of force, a leg or of something hit on the knee from the side or from the front? Or was it that once the injury happened, what type of swelling developed? Did the swelling develop immediately, or it developed over the period of time? Let's say the game got finished, and after when he came back home, it started this swelling around, and then eventually over 4 to 6 hours period, the swelling developed. Was the patient was able to continue playing after the injury or not? Because that is actually what differentiates from a more severe ACL with meniscus injury and mild meniscal tears actually. So what type of symptoms usually come? The first and foremost is always pain. The most commonly it's usually pain associated with swelling, especially after the injury happened, which happened during a sporting activity. So if the patient is having pain with some type of an injury is due to some any rotary injury, you must be thinking of the problems associated with the knee like meniscal tears, ACL, PCL, or even the ligamentous tear as well, because all these injury can happen during a rotary traumatic event, which may be associated with pain and swelling or effusion of the knee joint. Then once initial stage happens and slight effusion and swelling subsides, patients take some medications, take some rest. Over the period of time, it actually subsides. Later on, depending upon what type of injury it occurred, if it was intrasubstance tear, which may heal over a period of time, or if it happened to be a bucket handle tear like this one, or a parrot beak tear in this situation, now this may get either dislodged as a foreign body, or this bucket handle tear may be continuous source of kind of a snapping sensation. There's actually locking and catching sensation over the period of time. These produces classical mechanical symptoms, which usually leads to the patient comes and complains that I had a trauma. It did happen that time ago, and after on that day I did develop pain. There was swelling which settled down with medication over the period of time. And in our case study, he was having a problem in the right knee for past 18 months, but there was no pain in effusion. There was only snapping sensation. So what happens is once the acute stage settles down, this is what happens, that only the mechanical symptoms persist. And mechanical symptoms are kind of locking and catching when the knee is going from flexion to extension and extension to flexion. And this actually is more problematic because the patient sometimes complains that suddenly his knee gets locked and he's unable to completely extend it, or suddenly at certain point of time he's unable to even bend it properly because of something which is getting stuck in the knee as well. And this sticking in, what gets actually stuck in is basically mainly usually a bucket handle tear, which classically presents with a more mechanical symptom than any other tear, because it is actually happens is there's a whole segment which is actually separated and flaps back and gets stuck in the usually between the posterior and anterior horn, and this can be problematic, especially whenever you have to extend the knee. It gets stuck in and it makes kind of a nuisance for the patient to do actually continue his or her activities of daily living. And then there are other symptoms as well, which could be leading to, in acute stage, this could be simply pain, swelling, effusion, and tenderness as well. Mainly, it's always depending if it's medial meniscus, this always will be associated with medial joint line tenderness. And if it's lateral meniscus, there will always be associated with lateral joint line tenderness. Usually, effusion could be on the one side or it could be global effusion. Usually effusion is massive enough that sometimes we feel that something is actually not wrong with meniscus, but with there may be associated parapatellar swelling as well. Therefore, swelling and pain are the two most important symptoms in acute settings. While in the chronic settings, once effusion, swelling, pain settles down, it is mainly the locking and catching a snapping sensation due to the mechanical symptoms which play their important role as when actually the meniscal tear occurs. And that is why we call it as a locked knee syndrome. The patient's main complaint in chronic stage is usually that patient has locked knee. While in case of acute, the main problem is always the pain and the swelling around the knee joint.